Uninterrupted power supply and other life-saving equipment dependent on stable power have been destroyed. We've got a conversation on this morning. In the studio with me, first of all, is Professor Titus Bayu, former General Secretary of the Ghana Medical Association. We'd also be joined by Dr. Anthony Siasari, former CEO of CAF, and Bright Nyarko, National Chairman of the Coalition of NGOs in Health, all coming together to get into what really is the power situation and how it's affecting our health sector. Join me for that conversation. Professor Titus Bayu, thank you so much for joining us in the studio. I'm sure you've been following the issues, especially on this power outages. Let me start by asking, what are your initial thoughts on this conversation?
Yeah, good morning and happy Easter to you.
Happy Easter.
It's an Easter picnic morning for all of us in the country, and let me say a very good morning to the people listening to me from Lambuse. If I have your permission, let me greet in my local dialect, the Easter greeting. So I will say first in Sisali, Easter Wero, and then in Dagari, in Easter Yani. And it's just a greeting the Easter morning to everyone. I know people are in the churches and everywhere for picnics this morning. And we are happy to be here to have this discussion. I think it's very disturbing. My initial comment will be that it's very, very disturbing and disappointing. As a clinician myself, one who works in the surgical space, I think it's unacceptable. And not under any circumstance should this be accepted anywhere in the world. But what is even more frustrating is that it's erratic, without a schedule, and the hospitals cannot plan. And maybe I just explained to you what I mean by the hospitals cannot plan. In the hospital setting, we have emergency situations and we have planned situations. So if, for instance, the hospital knows that we would be out of power from this morning till evening, they could decide not to schedule any elective surgery at that time. Elective surgeries are planned surgeries. So to plan and take someone to theater only not to have power is unacceptable. I mean, it violates all our fundamental ethical principles. If you come in an emergency, we have to operate you. That is an emergency. Power or no power, we go in, because if you don't go in, the worst could happen. But if you are stable and we initiate the process with an uncertainty of the supply of power and something happens, it's very, very, very unethical and unacceptable. So the erratic nature of it doesn't help. And the other part that doesn't just make logic to me is this whole demand of ECG threatening everyone here and there, pay our bills or we disconnect the hospital. It's just strange that the power distributor can actually issue an ultimatum to a hospital. I can't wrap my head around it.
You can't think far.
No, I can't think far. It's one of the things you say, you go explain tire. I mean, is that to say that the ECG boss, their workers and staff think that they can never fall ill and be in the hospital? Maybe on your way to that press conference or you're on your way to even to that hospital to go and disconnect. What if you fell unconscious there and you need to be on a life support machine? What happens to you? You know, I mean, these are things that I think is the last that should have happened. And I have a few documentations that if you look at the genesis of all of this, there was a letter from the Ghana Ministry of Health to its agencies. This was dated in June, I think June 2023, where the ministry wrote to the agencies like the teaching hospitals, the Ghana Health Service, CHAC, that's the Christian Health Association, and informed these agencies that they had had some discussions with the ECG and they wanted to settle indebtedness. Now, if you look at the requirement that the ministry put in there, with your permission, I'll read some specific things in verbatim. After discussions at the meeting, it was agreed that the Ministry of Health's total indebtedness to the ECG will be used to offset the ECG's tax liabilities to GRA through concessionary agreements. And this ought to be facilitated by the Ministry of Finance. And all these sectors were at this meeting in June.
June last year.
Last year. So how did we get it wrong? That today you tell someone they are owing 20-something million cedis and therefore you are going to disconnect. So is it that, what happened to this point 2 of this letter? Now, I'll just go to another one. To avoid accumulation of electricity bills and the disconnection of power for service provision, this point 4 of the same letter. In the future, facilities are encouraged to adequately make provisions from IGF and pay for same, that's the electricity bill, starting from June 2023. Now, this is mid-year, and this particular point does not make sense to me because facilities budgets, their budget is approved, and in the middle of the year, you ask that they should make provisions to pay for the electricity bill. Meanwhile, the status quo ante was that government was settling all these bills. If you wanted the facilities to take over payment of their bills, could you not go to this concessionary agreement, wipe off all ancestral bills, and tell them, starting next year, budget for this. Make sure that you input it into your cost items and pay for it. Let me read another very interesting one, which is, in accordance with the decisions made at the meeting, the ministry is currently liaising with the Ministry of Energy, ECG, Volta River Authority, and the Northern Electricity Distribution Company, that's Nyarko, for work to begin on the separation of meters of essential service areas and non-essential service areas to ensure uninterrupted power supply in the future. What happened to this? So if all these things have been discussed and you get up one day and you say you are disconnecting an entire hospital like Kolebu, or you have these power fluctuations and the whole hospital goes off, really, have we come or have we gone?
You see, for me, it's the human angle. At what point do we become humans again? At what point do we consider that there are lives at stake? Before we even get into the discussion and analysis, let me read the story on myjoyonline.com about how terrible this power situation is getting. The story on CAT, it says the intermittent power cuts experienced in the last few weeks have destroyed several medical equipment at the Komfanochi Teaching Hospital, including the uninterrupted power supply system of the hospital. Mind you, this system is supposed to be a backup. So in case that something happens to the major power channels, they fall on this to ensure that lives are not lost.
Exactly.
Now, because of the erratic nature of the interrupted...
It blows them up.
It is destroyed. UPS is a type of power supply system with an integrated battery. And in the absence of primary mode or when power is shut down, the battery is used for the power source. Joy News sources indicate the sporadic nature of the outages has contributed to the breakdown of heavily dependent hospital machines, thereby affecting productivity. The recent power cuts have adversely affected healthcare delivery at Komfanochi Teaching Hospital and the Menchia Government Hospital, leading to a ravaging impact on the medical equipment. The unannounced nature of the outages has destroyed several life-saving equipment dependent on power. Professor Titus Bayu.
Yeah.
What do you think is the challenge, or what are the facts of this issue? We know that, of course, we are in debt. ECG is in debt. We do not have enough money to buy gas to power every distribution channel or outlet in the country. How are they managing this is the question of why so much secrecy and hush-hush treatment on what we all know to be the truth, even to the point of not admitting that it is doom so.
You know...
What do you think is our biggest challenge?
So I think what is even more frustrating is that officialdom is not communicating in a way that inspires confidence in this crisis management. And in the middle of crisis, communication is critical, and carrying the population along is important. And I have noted a very disturbing trend lately. And I will give credit to where credit is due. During the COVID era, I appreciated very much the communication of government. But since then, a lot of the things that have happened has left much to be desired. Look, when you look at our financial situation, When we're having economic challenges, some of us started making noise. Government have to call a national consensus meeting, let us all sit down, let's discuss the problem. And they said there was no problem. We are never going to the IMF. We are a proud nation. And when you make statements like that, and you are not a man who is very humble, it's very difficult to eat that humble pie and go back. We ended up going to the IMF in a moribund state where we need a resuscitation, in a state where we cannot negotiate. Now, government makes emphatic declaration that I'm going to keep the power on. The president states it emphatically, I'm keeping lights on forever. You are never going back to the dark days of Dumso. Now, with this and in the face of the reality we face, then it becomes a challenge for the government to come out and say, okay, we said we have a problem, but we will never go back to Dumso. But the truth is that we are there, so let's manage. But I think that admitting the challenges to us is a lesser evil than grandstanding, maintaining your pride while people suffer. And in the case of the health sector, lives are at stake. A simple statement by the government, and that, look, this is what we thought, but we have a challenge. What is the challenge? I'm hearing, I'm not an energy expert, but I'm hearing that, look, there is a supply issue, which makes more cogent argument than you to tell me that is it transmitters or some things have blown up, 600 of them, and therefore you are not able to maintain the supply. The challenge is coming from Gridco and not ECG. We don't care about all of this. All we care is that, will I have power or not? If I cannot have power, will I know when I will not have it so that I can plan with it? And
there's a general sense of understanding among the Ghanaian people.
Yes.
There might be times where we don't have power.
Yes.
It's been part of us since forever. Light off. We call it light off.
Yes.
Even before Doomsday.
We are not energy sufficient.
We are not
so
saying
please admit it. And when you are faced with such a challenge, you are sleeping in darkness. And then they are telling you in your face that there's no light off. And look at what is happening in the hospitals. I'm sure we will come into the details of that. Look at what happened in Tema General Hospital. Look at what you have just read from Konfanochi.
Yeah.
I personally have had an experience, and at some point I will share here. I will not want to mention the name of a hospital, but as a gynecologist, I was in theater performing a very difficult pelvic surgery, okay? Removing someone's uterus. In the middle of that surgery, light goes off. I expect the hospital's backup plan to support me. It didn't come on. Unknowing to me, this backup plan was faulty, where a patient is completely asleep on a life support machine, what we call the anesthesia machine, and is ventilating the patient. That machine then starts to run out of power. And then everybody says, Prof, can you hurry up? How do I hurry up when I can't see?
Yeah.
When I can't suck out blood?
Yeah.
When there's darkness in there? People are using phone torchlight for me to see. This, if it's an emergency, is understandable. But for a planned surgery that somebody is walking around, went to work on Monday to Friday, and then decides to come in on Saturday or Friday for a surgery, and I subject that person to this, does that make sense? It doesn't. These bills may be settled, or the concession arrangement may be done, but if lives are lost, can we bring those lives back?
So what was the value that the government is placing on the lives of the citizenry? That's the question. And at this point, I want to bring in Bright Amy Nyarko, who is a national chairman of the Coalition of NGOs in the Health. Mr. Nyarko, I'm sure you were following the conversation. We're talking about the effects of these power outages on our health facilities and lives in general. What will be your initial statements before we get into the conversation?
Thank you very much, my sister. I think I was following the conversation, and Professor Abiyu has said it all. It's a very worrying situation for all of us as patients and community groups. You see, this is actually unacceptable, and government has to take rigorous steps in doing something about it. For people to have confidence back in the facilities and then the hospitals that they attend. We have nowhere to go than the facilities that are in Ghana. And we cannot sit there and watch that we lose our families, our loved ones, our children, and then the very respectable people of Ghana in the way we are seeing things now. We think it is not acceptable at all.
So the question is, should health facilities actually experience power cuts, no matter the circumstances that cause it, should health facilities experience power cuts, even if it's load shedding? Yeah. Where does it stand? What does the law even say on this?
Okay, so the first...
Sorry, I was referring to Prof. I'm sorry about that. I was asking right. Prof. I'll bring you in, yeah.
So I would say that it is unacceptable, not under any circumstance. But we have a fundamental problem.
Okay.
And the fundamental problem is that our energy needs are not sufficient all the time. Technical faults can occur. And another fundamental problem is that if you go into our electrical distribution system, health facilities are not put on a separate grid. So it means that they blend within the communities in which they are, which is an error on its own. Ideally, health facilities should have been supplied with dedicated lines so that they can be isolated from any unexpected power outage, or even when there's supposed to be a load shedding, they can be separated from such load shedding. But in some places, health facilities are integrated into the normal grid, and therefore it's difficult to tease them out. That said, if the ECG or the power distribution companies want to do this is something that can be rectified. And as was proposed in that letter, the request also for separate metering in the hospitals, even within the hospital. If you go to a big hospital like Kolebu, you have medical student hostels, you have nursing hostels, you have staff accommodation on the compound.
Okay.
Then within the hospital, we have records, we have the offices, we have the theaters, we have the intensive care units, we have wards where patients are lying. How are these meted? You get what I'm trying to say? So if they are all on common lines and you cannot separate, then it becomes a problem. Now, if all these things are addressed such that you can do the separate metering that they are talking about, and they ought to be careful with the advent of the softwares that we are using, the digital system that we are using. There are some parts that were not considered essential, but they are now essential. So for instance, the records or the administration where the server sits. Because when that server goes off, I can't access any information on the patient. So you might only be thinking about the theaters or the intensive care unit. You go to stores. Stores, everybody will say, oh, that is just where we are keeping staff, so it can go off. Mind you, that's where our vaccines are kept. Vaccines are regulated in a very tight temperature. I'm wondering what all these fluctuations may have happened to some of our vaccines. At the end of the day, if the vaccines go outside the temperature range where they are considered efficacious, their safety, their efficacy becomes a challenge. You may give it to the person, all right, but don't get the desired benefit. So some of the impact is immediate, others are long-term. And therefore, if you put all these together, I would say health facilities should not experience any form of outages. But for us to get to that point, it has to be a process. Government must assist these health facilities to get enough backup power, because power systems is an engineering problem. It can go faulty any time. Just as human, the system is. You can be fine today, tomorrow you'll be sick. Yeah. So we will accept one or two blips here and there. But when they happen, what is the backup plan? Government should by this time can come up with a national project to assist health facilities to buy backup plants, because the smaller facilities don't have the capacity to buy. Second, solar. Why can't government install solar in some of the health facilities as backup or complementary power to the national grid? If we have this multimodal power supply, then you are assured that even if you get a little blip in the power supply, some other alternate means will come in.
Like the uninterrupted power, UPS.
Exactly, to maintain it. Because once you get a break in supply, depending on the nature of the health facility and what is being done at that time, a life is at risk, you know.
At this point, I want to bring back Mr. Nyarko as the chairman of the Coalition of NGOs in Health, referencing the issue from Tema General Hospital, where we saw a baby lose its life. And now we are hearing that the Komfo-Anokye Teaching Hospital, their uninterrupted power supply facility, has been destroyed, same as the Mensha Palace Government Hospital and others. As an NGO or coalition of NGOs, I know that you are not doing it for any gratification aside saving lives or from the human interest angle. Is this challenge something you're familiar with, and how bad is the situation really?
My sister, thank you very much. So you also agree with me that though in the past we have experienced bits and pieces of these things, it's become more rampant these days. And then viewing from the point of view of the General Hospital and other places that we cannot even establish because we couldn't see videos or audios about them. This has become very critical to all of us, where critically ill patients are losing their lives. I mean, they are at a higher risk of losing their lives that we cannot bring back. We could look at how equipment that were bought, very expensive, are also breaking down. Professor Adeyo talked about the vaccines, and if we want to go there, we would even be vaccinating our children under 5 and then adults with something we cannot talk about because of its efficacy now. We will be experiencing a whole lot of breakdown of very valuable hospital equipment, and that is what we are speaking to for government to understand us and then make progress. You see, it has a very serious impact on our lives as people and community members. Everybody in one time or the other in Ghana will become a patient. Probably for now, if you don't know that you are sick, you see yourself as being healthy, so you will not get to what we are talking about. But let's speak to the issues that our wives will be going to the facilities, who are pregnant and goes through these major surgical operations, our old fathers who go through prostate operations and other things, breast cancer operations and major other operations will be experiencing what we are talking about. And some of them may even lose their lives in the process, but we might not be able to count them all unless somebody boldly comes out with a video or something that we want to talk about. This is the reasons why we say it is not acceptable. The hospitals are not supposed to be built the way we are looking at things, and especially the posture that ECG is taking in publishing the names of hospitals that are owing. If we are looking at it in the short term, we should rather be looking at how we can provide separate metering or billing systems for these facilities, where we could look at the theaters, the emergencies, the ICUs and others, put probably on a what we call the postpaid meters, and then the bungalows, the offices and other things are put on a prepaid schedule. And then they are properly regulated. I believe every district has its own power control systems, and they should be able to, lay that of the facilities of the major grade and supported with even additional plants, probably UPS and then solar, so that we are rather boosting the hospitals to be able to work 24/7 and provide better services for us, other than putting more pressure on the health worker. As the professor speaks, you heard him right. Somebody who is in the theater conducting a major operation, and then the family and his own colleagues are giving him pressure. Please hurry up, with the sense that he's losing the patient. And when this patient is lost and then they come out, the pressure is even going to be more and severe, coupled with other things by law. They will be doing audits and all that kind of thing, as if it is the fault of this person who was conducting the operation. So this is not something that we have to be joking with or playing along with. It is something that government has to really take serious and then look at what we could do about it moving forward. In a short term, probably we have to look at supporting the facilities with plans, and also look at how we could do their billing systems, the metering systems there to support them. But in a very long term, we should also be looking at if there is a need to bring out a tax that would pay for all facilities free. And we, the NGOs, were looking at it from our point of view that secondary schools, universities, basic schools, and even hospitals, all these social amenities that they are using, utility bills, water and electricity, should be free. Because every family, every plan, or every family, religious group, church or mosque or whatever would have a member in a hospital or a school. And at the end of the day, they are the same people who are paying taxes for Ghanaians to use, for Ghanaian government to use in developing our country. So why can't we, in the long term, look at how we could make these things free so that they would have the peace of mind to, take care of us, our wives, our children, and all the people, our elderly, and then the other communities. So we live in Ghana freely and happily. It's actually a very worrying situation. ECG has to look at it well and come out again.
Well, both you, Mr. Nyarko, and Professor Bayu mentioned solar. Yeah. And in the story you told about being in surgery and nearly losing a life, if that had been the case, if you had lost a life, you would have said that because of that power outage, you were unable to deliver on your job, right?
Yeah.
So now let's talk about this culture of silence and the way that some health facilities are refusing to state the thing as it is. Again, I'm referencing the Tema General Hospital.
Yeah.
What do you think accounts for that level of secrecy, or what do they have to hide? If indeed there was a power outage that caused the loss of a life, what are the repercussions for coming out clearly to say that indeed there was light off, which caused us to lose a life, Professor Bayu?
Well, without going into the facts of the Tema General Hospital, because I'm not abreast with all the facts, I do have.
So it's if.
Yeah.
If they came out to say that this is.
So, but to say that I have read their statement, and I can understand their difficulty, but that doesn't explain away a life. We do not know if that life was lost necessarily because of that. But when I read that it took 2 hours to re-establish connection, I just told myself, anybody medically inclined reading this will know that depending on the situation. And I think that they were honest there by putting that 2 hours in there. They were honest, but that tells the difficulty of the situation. Assuming that somebody...
2 hours not a long...
That's what I'm coming to. For them to put it there, knowing the consequences, it means that is the honest truth they have spoken.
Okay.
Because assuming that someone was on life support, or a baby was on a ventilator, or a CPAP, and the power is off for 2 hours, and that machine does not have an internal battery, or its internal battery also breaks down. Now, what it means is that somebody has to physically breathe, literally, for that child for 2 hours. And we do that by what we call bagging. Yeah. So somebody standing there blowing air gently into that child for 2 hours. Humans are not designed to function that way. So it will mean that people have to do that in tense. So someone may do it for some 10 minutes, someone else come and do it for some 10 minutes, and then all of that. So, well, that's what I'm saying. I don't know the facts, but 2 hours is a pretty long time for anything to happen. But to answer your question straightforward, by our training, health workers are trained to be very honest, speak the truth, and auditing processes will go through in all of this. What is regulated, however, is how we communicate to the external world. Because, and I think that is just normal for all institutions to have their protocols. In multimedia here, if there's an incident, you have an authorized person that can speak to the press or speak to the matter. You don't expect any worker to get up and speak on what is happening. So when things happen like this, we want to hear from the official communication channel. So it's unacceptable for individuals, workers to take a phone and make a recording and post it on social media or just speak to the matter, because there are official communication lines. But no professional, properly so trained, is going to lie on this, because one of our fundamental ethical principles is not to tell a lie. And so you expect that the full truth will be there. All the documentations will be there. No one will change the documentation because this has happened, because auditing will take place and everything will be clear. Whether the institution or the agency or the ultimate person responsible is willing to bring all that public is another question for interrogation. But I do not think that any health worker under that circumstance is going to lie. You understand? So putting it straight, it may be the communication people, those managing the system, that may be trying to manage the information and all of that. But you also know that when we communicate, you also want to make sure that you don't inspire fear, anxiety, and all of that. You also don't want to let people lose trust in the system. But honesty is critical. And for me, for them putting out that they struggle for 2 hours, I'm just imagining in other sectors of even the hospital. So assuming someone was in a theater and had to continue for 2 hours without light, assuming someone was being ventilated or on dialysis, the machine will shut off. So what happens for that 2 hours?
Yeah.
And if you're on dialysis, what you know is that the machine takes a significant portion of your blood into itself, purifies it and brings it back. So assuming that there is an abrupt cessation and a significant proportion of your blood is inside the machine, and what is in you is not enough to even sustain for a long time, what happens to you? So a lot of things can go wrong, you know. So like we're saying, the best is to prevent it, you know. But I just don't think that any professional, a doctor, a nurse, a midwife, would conceal the truth.
I'll take that in good faith.
Yes.
Mr. Nyarko, you mentioned that we need to plan ahead. We need some sort of long-term planning and strategy if we are going to stay afloat in this current power outages. What are some of the things that we should be doing or looking at doing? I mean, how do we reconcile where we are? The real situation is that we do not have enough power for everyone, and health facilities need to operate on power. From where you stand, what can we do about the situation?
So thank you very much once again. So you agree with me that there are very basic things we can put in place now. We can strengthen our maintenance systems at the various facilities where they have the plants. Those that they don't have, buying the gene sets or the solar system or even UPS that will be able to sustain their power for some time now, it is not too much a big thing for government to do. So in the short term, we have to look at getting even facilities that do not have the plants, some plants, to support their power systems, instead of chasing them to come and pay their bills, so that they are able to take care of their patients. We should also look out that we are not preparing communities and people to lose trust and confidence in our health facilities. Then we are doomed forever. I think government should also not think, or facilities themselves should not think of shifting the costs of electricity onto the patients, which will be too much for them to bear as we sit now. But in a very, very short term, the electricity company and then the facilities should have some form of dialogue to look at what they can take off the various departments in the facilities, i.e. the theater, the ICUs, the emergencies, and the wards, and look at what they can do for them. These places are very critical because they have a kind of an in-service or an IPD case of operations, and they need electricity 24/7. So if they are supposed to put these ones on a billing system that will be able to provide them sufficient power throughout the 24-hour of their operations, it is good. If they don't have the plans, government should support them. Then in a lasting solution where we are thinking of sustainability of these services, we are thinking that government should look at other taxes that they can exempt. Probably they can take away what we call COVID-19 and the others, and look at probably rewarding those taxes to take care of the payment of utility bills for these public facilities. The hospitals, we talk about the schools, the junior high schools, the senior high schools, and even the universities. Very soon we are talking about the health facilities. It will hit the secondary schools, and all of us will come back to discussing this same topic on TV and in the public event again. What long-term measures is government putting in place to absorb the cost of these facilities, and especially for the health facility, exempt them from all these kind of schedules and maintain a proper power supply for them to do their work and protect Ghanaians? Today, you might have your money even to go to the hospital and pay, but it is possible that you are going to lose your life because there will be no adequate power supply to sustain you on the machine that you are kept on. And when that happens, the whole family is going to be in turmoil, and then everybody is going to go through this hardship because they have lost the breadwinner who in other sense would have been able to sustain his or her life when there was power on. So we should rather look at backing them up, providing backup systems, rather than rushing on them to pay bills and so on and forth. That and all these things hit back at the communities and the families, and then we lose our citizens instead of protecting them. It is not a good strategy to be chasing health facilities to be paying bills in that order where ECG is publishing their names and so on and forth.
Yeah.
It is not a very good strategy at all. We think they should rather look at how they can sustain their power and take them off the major power outbreak systems and provide them with a requisite schedule where it will put them in a position to prepare themselves for any eventualities rather than chasing them out with these things. Thank you.
Thank you. So plans, taxes, and some long-term planning from governments. But these plans, I wrote down that what's the cost? How much do these plans cost? For instance, for Tema General Hospital, for instance, if the government is supposed to provide them with a plant that they can fall on in the absence of solar and the actual power from ECG, what are we looking at in terms of figures?
So I cannot give you exact figures, but I believe that a place like Tema General Hospital, it's not like they don't have a plant at all. They have a plant. Probably it is old and some parts are weak. They
is it big enough to accommodate all the facilities and equipment that the hospital, would need in the absence of power?
So that is why I said they should look at how they could divide the facilities and what they put on the others. Okay. If you look at the emergencies, the theater, the ICUs, and then the other places, they could put them on a separate plant. And then the others could look at probably the offices and the other spaces could look at maybe a solar, which doesn't actually demand so much from them. It's just the comfort bit where they could put off their ACs and other things and use fans. But at least for the main power, we have to put them on this gene set where they will be able to have adequate power supply to be doing the work they have to do. Places like the theater and other places, we have to give them a specialized plant where they have power 24/7 to do their work. And that is what we are proposing government look at and do for them.
Right, thank you. Before I come back to you, Professor Bayo, on what's the way forward, I want us to stay on the gravity of the situation. Okay. There are some sounds from some managers of hospitals. First, let's listen to the General Secretary of Ghana Medical Association, Richie Salome, on what he's saying is the gravity of the situation. Take a listen.
It is very important that we put the issue into context. It's not about when only somebody dies, but people may even suffer irreparable damage just because the power has been off. I'm sure you read the Tema General Hospital statement where they said they took 2 hours to solve the problem. When it comes to life and death situations, 2 hours is too long a time. And so it's important that we discuss this issue in that context. Of course, our members across the country are reporting various challenges. Some have had to use torches to complete surgeries during procedures. Some have had to revert to the paper systems because the systems were down. And so it's a challenge. It's a big challenge that is happening across the country. And we need to immediately begin to discuss ways to address that. For us, as an association, we are not bothered about what people want to call it. So whatever you want to call it, we don't really bother about that. What is important is that for critical installations as hospitals, they need to know the timing of these outages, especially where we know that they are being done at certain times, and so that they can plan.
Right. Another sound from Dr. Swapenyo, who is also the general manager at Bridge Hospital. Take a listen. We'll be back.
Be sure about, this power. Sometimes you're in surgery and the lights go off. And so it affects even planning. Some surgeries can wait, but if you have a cancer surgery, you cannot wait for too long. So that's why, as a medical association, we are calling for schedule. If we knew, they would say, okay, all our surgeries we're going to have power on Tuesday. So book surgeries. Patients come on admission Monday. We do surgeries for you on Tuesday. But I'm working in the dark. I book you for Wednesday. Wednesday there's no power. Genset is working all right, but to what extent? Genset is supposed to be a stopgap. Light goes off, it comes in quickly, so there's no break, and the lights come. But the exception is becoming the rule. We wish and pray things get better for our country.
Wish so.
Right. So there you have it. Most of these health workers, doctors and managers, businessmen in health and NGOs in the health sector are asking for a timetable.
Yeah.
Because if you do not know when the lights will go off and you schedule a patient for a surgery that's life or death, which is a life or death situation, you're basically gambling with the life of the patient. Professor Abeyu.
You see, I don't know how to even amplify this more, but you notice that we are speaking the same language. Yeah. The General Secretary and my colleague who spoke. And this is not rocket science. Let's say within Accra, if I know that there will be no light around Rich Hospital, and we even have patients on ICU or a patient that needs ICU care, I wouldn't send that patient to Rich Hospital because there are other areas that will have ICU services, like Kolebu, like the Bank Hospital. There are private ones that we could go there for a brief period. So this request for a schedule, I followed it, and when we speak, people put a political spin to it and all of that. Honestly, it does all of us a lot of good, especially in the health sector.
Yeah.
See, I gave example of individual patients. You may have a medication that needs to be kept in the fridge at home, like insulin. You put it there, and this Ghana, we are at the warmest part of the year for us as a country. So you leave your insulin in your fridge, and you go to work. You come back, lights have been out the whole day. You didn't know, you didn't plan for it. Temperature is 39 degrees. In fact, when I was I just came back from my district, my constituency, the Lambuse constituency. In Lambuse, at some time, it hits 39. Most medications are supposed to be stored at cool temperature, not above 25 degrees. So imagine what will happen to that medication.
Taking medication just to kill yourself.
It loses its potency and it could become anything else. Yeah. So the importance of a schedule cannot be overemphasized. We should not play politics with it, dance around it. I'm a politician now, but since I've been speaking here, I've never taken any political direction to this. We are looking at what will save this nation and the people, their lives. Sometimes we should be able to put all these political... Look, if you cut someone's blood, you can't see NDC or MPP or GCPP flowing in that blood. It's the same. And there's one aspect of health that equalizes us, and that is the emergency services. It doesn't matter whether you are the president of Ghana. We have had a president die in an emergency before. It doesn't matter if you're a minister. It doesn't matter if you're a clergyman. All of us are at equal risk when it comes to the emergency, because when you collapse here, you don't determine where people take you. The people around you determine where they will take you.
Yeah. You're not conscious and
you don't know
aware
anything.
At the time.
You can't choose who takes care of you.
Yeah.
When I train my medical students, I train them and I tell them, I want you to be good, because when I am ill, I can't select the doctor to manage me. So every doctor practicing in Ghana must be good.
Yeah.
So that when I'm unconscious, it doesn't matter which hospital I land in, I know the doctor taking care of me, I can trust. This is the situation we face ourselves with emergency care. And so this power outages is unacceptable. Let me give some quick solutions. If there's time, I'll elaborate on them. First is that fundamentally, government must recognize that the hospitals cannot pay these bills. Some are ancestral bills accumulated by government. Government was supposed to have paid these bills over the years. They have not paid. In this discussion that involved Ministry of Finance, Ministry of Health, ECG, they came to agreement. ECG has tax liabilities. The ECG should do like a swap.
Like a batter, yeah.
Clear off all these bills. If government wants the facility to take up the bill, first thing is that you are talking of IGF. That would mean that facilities are going to be charging people, which you do not want. which the NGOs in health is saying no. Health is a social service. People should be able to access healthcare. Imagine that a facility decide, like Kolebu decide that we are putting 10 cedis on every patient's bill for electricity. You will get a public outcry because that 10 cedis will prevent someone from accessing healthcare. And so this must be planned. Most public hospitals rely exclusively on the NHIS. The NHIS pricing model doesn't have any component for electricity. So are we going to discuss it? That if NHIS is going to pay premium for every outpatient, it should pay 1 cedi for electricity, should you pay 2 cedi for every inpatient? If you have surgery lasting this hour, should they add this amount for this? This needs a lot of thought process, thinking through to come to that point. So government must hasten slowly. What I see is that, okay, government says ECG, pay some amount to your power suppliers, and then send a certain amount this way, and ECG is struggling to meet it, and then, okay, let's touch the sensitive centers, healthcare, or go and switch off a school light. No. There will be public outcry. Then all of us will come in.
Now saying it's Gridco. Gridco has gone to disconnect the supply point somewhere.
So then the people then fight the battle for ECG. This is essentially a battle between two government agencies. ECG belongs to the government. These hospitals we are talking of belong to the government. Why should the innocent patient suffer for it? Let the two sit down and talk. Let us agree what to do. Okay, ECG, you owe me this in taxes. You owe me this. Let's swap. Fresh slate. We are beginning. From next year, this is what we are going to do. Government tell the managers of the facility, because they employ them. Okay, charge this amount for electricity.
And this is doable, no?
It is doable. Yeah. Or ask NHIS, put something on it for electricity. And then things can be done. That's the first point. Immediate solution is that debt should be wiped. It should never be mentioned anywhere. It doesn't make logic.
But Abeyo, they need the money, though.
They need the money for what?
It's revenue.
To whom?
To the country, GRA, us.
GRA?
Yes. You're saying that they could do it better.
Yes.
Now, what would they be getting in return?
No,
if they scrap these monies.
Yes.
These are not small figures.
No, they are taking the money to go and pay who? They are sending that money to governments. Mm-hmm. These facilities generate the IGF in trust for governments. No hospital manager.
As part of IMF program,
yes,
they are supposed to, mobilize funds to pay off our debt. So maybe they need the money to offset those debts as well.
So I didn't want to go to IMF, but
we live in an IMF.
If you are taking us there, we will get there. If you go to IMF in a moribund state and go in there and then you accept all sorts of terms, this is what happens to you. You are virtually now going to kill people, virtually, literally. Okay, just to meet conditionalities. What are we saying? Wait a minute. That switch off power to Kolebu, to 37, so that you can mobilize revenue to meet your targets, to satisfy IMF? Definitely not. Now, this money they are mobilizing is because government has given an instruction they must pay a certain amount to power suppliers, which government will have paid that is not able to pay. Right? And therefore they say ECG to bring it and then pay.
Right.
Is that the only means by which we can make this money?
Time is not on our side.
So my conclusion of it then is that, look, that exchange should happen. They should wipe off all the old bills. No one should be surcharged to pay for this. Government should find creative ways. Look, we are still collecting COVID-19 levy. What are we using it for? It cannot be used for something like this. Now, the other thing is this metering we talked about, which my colleague, Mr. Nyarko, also alluded to. Within the facilities, there are institutions, educational institutions, other non-essential institutions there, but we know the vital centers.
Yeah.
Can we guarantee supply to these areas? The backup plants, they don't come cheap. And so some facilities need help. NHIS is in areas of facilities. How can they buy them? Government can go as a big purchaser, negotiate very good terms, and supply these things to the facilities. And it will be a backup. Government can go, look, even private companies like Stanchart is doing a solar installation package for corporate individuals. You can take and pay in bits. I imagine government is the one
leading this.
We
have so much sun.
I can give solar to all health facilities in Ghana immediately up to this capacity and give them 3 years to pay. Which bank will not guarantee this? Which bank will not go for this?
Please hold for me. I'll come back for your final thoughts. I saw Mr. Nyarko nodding his head. Mr. Nyarko, how do you react to first the sound from the managers from these hospitals? And you can wrap it up for me with your final thoughts.
Yes, thank you very much once again. In fact, when Professor Bello speaks, it's so touching that I feel like he's talking like a civil society person.
Yeah, you were really nodding.
Just like me. But he's really speaking to the issues like a social service, you understand? And those are what we are all looking out for. If we want to say use the debt that the facilities are owing as a yardstick to punish them or whatever before we give them power, that is not the best way. If we want people to die at the expense of the debts they are owing, the fastest way to do that is rather pull the trigger and get them shot. They will die faster. But we don't have to make them go through these pains, pain over pain, pain on family, pain on everybody before they even die, even pain on the service provider. So what I'm saying is, not until somebody gets there in an emergency situation, we can continue to live and think the way we are thinking and go ahead. But definitely one day somebody will go there. And when the situation is the same, you will feel it the way all of us are saying it. Government should wipe off this debt. I mean, there's no debt on the health facilities. Every money that is being accrued is going back to government. And you are taking it from your people, and the people are suffering. So can't you absorb these things and then make them free so that they receive the health care that they need? This is what we are talking about. And I don't think it is too much for government to do.
Maybe you in the NGOs and other social entities can force the hands of government. But Mr. Nyarko, please wrap it up for me in about 30 seconds. We don't have time.
So thank you for the opportunity. I think this whole issue that we are discussing, government should come back to look at it.
Yeah.
The electricity company should reason up with us and then get to know that these particular services has to do with losing people's lives. And when one soul is lost, we cannot replenish it. We cannot bring it back. And for that reason, we have to look at how we can all put energies together and help the health facilities sustain their energy and their power in operating at the facilities that they are. Government should support them so that we all live healthy and then we continue to live better as Ghanaians and families become very happy. Thank you very much.
Thank you so much, Mr. Nyarko. Professor Bello.
Yes.
How are you wrapping this conversation up?
The summary I would just say is that we should use a common sense approach. No life, we cannot value a life. The person we are losing, that baby we lost, we do not know if that baby is going to be the person who is going to bring some innovation that saves the whole nation. We cannot tell the productivity level of people. So no life should be lost from a preventable cause like power outage. As long as it can be done, let's supply the power. ECG should come up with a schedule for people to know, because the health facilities are embedded in communities and they can tell from the schedule when they are likely to go off and plan, so they don't put elective surgeries and procedures on that day. They can do other things, like run an outpatient clinic, but don't operate on the day where they are going to go off. That schedule is paramount. The prerequisite for this draconian thing has not been fulfilled, which is that separate metering must be done, backup power system should be done, old bills must be paid, and new financing models should be provided before you can go to the point that you have been given the way to generate this money. You have not generated it, and therefore I'm taking off your power. Even then, go and take off the power at the residence of the hospital CEO, not the theater. Go and take off his office, not the theater. And that can happen when we have this differential metering. So I just want to appeal, and for the ECG in particular, I just want to let them know. I mean, I have been a union leader before, and I can sense what they are doing. You need something from your father. You cannot get it from your father. So you go and attack your little brother. So your father comes in and says, why are you doing to your little brother? Or your other brothers scream, and then they get the attention of your father. Please be bold. Face the government. Tell them what it is. And I think this is the time we need leadership. I would be happy as an ECG MD to say that this is my load schedule plan. This is what it is. If you want to fire me, fire me. This ECG boss has done so well. And a lot of us had a lot of admiration for him in the delivery of how the innovations he had brought in. He should not end his tenure this way by just succumbing to this kind of pressure, saying there's no load shedding when we can feel it that there's a load shedding. And you should be mindful that there are health facilities within these places. And the next life, you can't tell, maybe too precious. Every life is precious. So we should not lose lives just because of this. I think that would be my final submission.
Well, there you have it. Thank you so much. What little I have to add is that just like every little drop of water makes the mighty ocean, there is no government without people, and there's no country without the people. So every life in this country matters. It's time that the government puts aside their political aspirations and stop impoverishing this country and actually have the people at heart, because we are. You are because we are.
Exactly.
Please help us. My guest for this conversation was Bright Nyarko, who is National Chairman, Coalition of NGOs in Health. Thank you so much for joining us. And I was also joined in the studio by Professor Titus Bayu. Professor Titus Bayu, thank you so much for joining us for this conversation.
Thank you for having me.
It's a wrap for the first belt of the big stories, and there's still more to come. Please stay with us. I'll be back shortly.